Welcome to Mental Health Resilience for Nurses, Knowledge Byte 4. Knowledge Byte 4 outlines taking control, the 5 pillars of resilience, review, building self awareness, building connection, finding purpose, investing in self care, mindfulness, focusing on healthy thinking, asking for help, and additional resources. Knowledge Byte for learning outcomes. After working through this knowledge byte, you should know some practical ways to build self awareness, build connection, find purpose, invest in self care, practice mindfulness, and focus on healthy thinking. Know when to ask for help and where to find it. Taking control. In Knowledge Byte 3, we learned that mental resilience can be practiced and built over time, and that there are 5 pillars of resilience to concentrate on. By focusing on these 5 pillars, we can take control of our reaction and response to difficult and stressful situations, even if we are unable to control or change the situation itself. Let's have a closer look at practical ways to incorporate the 5 pillars into your daily lives. The 5 pillars of resilience. Building resilience can be done by focusing on 5 core concepts. Number 1, self awareness. Number 2, connection. Number 3, purpose. Number 4, self care. And number 5, healthy thinking. Building self awareness. Self awareness is having a clear understanding of who you are. To build self awareness, keep a journal. Note things like your thoughts, emotions, fears, strengths, and weaknesses, especially on days that you find challenging. Reflect on your dreams and aspirations, and about which things in life you value. It can be big things like building a house or simply appreciating your morning coffee. You can also use your journal to capture these things. Try creative ways like drawing or scrapbooking, if writing is not your thing. Speak to a trusted friend or family member. Ask them about what they think your strengths are and on which areas you can improve. Building connection. Building healthy relationships with others allow us to grow, give and receive support when we need it. To build social connection, ensure that you prioritize important and healthy relationships and invest the necessary time and energy in them. Try to seek out people who are empathetic, trustworthy, and who respect and value your feelings. Join a group. Depending on your interests, this may be a community or charity group. Working with such a group can help bring you a sense of purpose, joy, support, and connection. Finding purpose. Purpose is feeling that we belong and serve a bigger goal than ourselves. To find a purpose, help others, volunteer, or simply support a friend. Take initiative. When one journey comes to an end, for example, a job loss, try to find the starting point of your new journey. For example, prepare your CV or work on building your work skills. Take small steps towards your goal and recognize each milestone of progress and learn from hard times. Use the opportunity to self discover. Investing in self care. Self care is a continuous act of treating ourselves with respect, understanding, and actively doing things to look after ourselves. Remember, if you don't take care of yourself, there will come a time when you will no longer be able to take care of others. Invest in self care. Take good care of your body. Get enough sleep and exercise, and follow a healthy diet. Avoid harmful behaviors like smoking or alcohol or drug misuse. It may provide temporary relief, but will hurt you and lead to even more challenges in the long run. Make time for the things you enjoy. For example, take a standing diary entry for a movie with your partner, or put aside some time every evening to read a few pages from a book you enjoy. Try out breathing exercises and meditation, or practice mindfulness. Mindfulness refers to being focused and aware of sensations in the current moment, the increased awareness about our surrounding environment in our bodies and emotions. Example, instead of scrolling on your phone while having dinner, put your phone away and focus on the taste and texture of every bite. Your mind will become calmer, you will digest your food better, and you will probably enjoy your food much more. Mindfulness has been shown to improve outcomes in depression and anxiety. Focusing on healthy thinking. Shift your focus to healthy thinking by maintaining a healthy perspective. See both the positive and negatives. Accepting change. Focus on the things you can change and accept the ones you can't. Remaining hopeful. Try to focus on what you want instead of your fears. Learning from the past. Take the lesson from your past hard times and use them to your advantage in the present and future. Express gratitude. Try writing a gratitude letter to someone who means something to you or who has done something good for you. Be specific about what they have done for you and how it affects you. Taking a moment to practice the good things. Asking for help. Just like physical ailments, we sometimes need help from others to get through difficult times. If you find that you are not making progress and or becoming increasingly anxious or depressed, and especially if it starts to affect your daily function, for example, at work, at home, or at school, consult a mental health care worker for advice and guidance. A good place to start is your general practitioner or local clinic. After an initial assessment, they may offer a management plan or refer you to more specialized mental health care workers if necessary. Your employer or medical aid may also have a mental health support program. Be sure to ask your HR representative or medical aid if you have one. Don't be scared or embarrassed to ask for help. Remember, 1 in 3 South Africans will be affected by mental illness in some point of their lives. And just like with diabetes, we may need the assistance of a healthcare worker to get better. You are welcome to contact SADAC's Suicide Crisis Line at 0800 567 567 or SADAC 24-hour helpline at 0800 456 789, or you can always contact Lifeline National Counseling Line at 0861 322 322. Asking for help. If you feel like you can't carry on and or you may harm yourself or someone else, seek help immediately. Seek help immediately. You are more than what you might feel in that moment. Reach out and let someone assist you.